Hi, good morning. Welcome to this week's version of Toothday Scoop. So you see that I have in my hand a very stinky hard-boiled egg, but I'm going to use this as a visual aid. We ordered a model of a tooth and it's coming, I guess, these next few days, but in honor of Easter, I'm going to use my first idea and just go with an egg. So my topic for today basically is when people say, why, dentist, does my tooth hurt after you worked on it? And it didn't hurt before you worked on it. So this is a frustrating thing for both parties, and I think, sometimes this happens, sometimes it doesn't, but when it does happen, it's frustrating, and maybe it's because I didn't do a very good job of explaining things, but I don't think it's a good idea that I bring an egg into every visit. Anyway, this is a good analogy, the layers of an egg and the layers of your tooth. So let's pretend, well, obviously it doesn't have any roots, but this is your tooth. I cut it in half, so it's a little bit of a mess, but maybe it's, analogous to a tooth that needs some help. But just to show the layers. So the shell is your enamel, okay, and that's what you see. And if your teeth were really this smooth, that would really be awesome because it would be harder for cavities to grow, but they're not. Anyway, so let's look at the layers. So inside is this next layer, the egg white. We call that dentin, and that area does have some feeling when we touch it. Like when we numb you to drill it on your tooth to fill a cavity. If that's not entirely numb and we're getting into the egg white, we're getting into the dentin, you're going to feel that. So that's why we numb you. And if you have a cavity that's growing into the dentin or just into the white here, it typically doesn't hurt. Some people will tell me that they maybe have some sensitivity to sweets or they may feel something, but not usually. I would say that's probably less than 5% of the time. People don't know they have a cavity growing here. If the cavity grows further and gets into the yolk here, this is the nerves and blood vessels, let's say, that's when it starts to hurt. And again, not always. Sometimes the cavity can get into the nerves, blood vessels and stuff, even kill the tooth and cause an abscess, and sometimes it still doesn't hurt. But typically, this is what I'm going to go back to though. When we're just in the egg white here, and you have a cavity that comes through the enamel, and it comes into here. So let's say we're going to take out some egg white here, and we work on it. So if it's diseased in this area, I remove the cavity, and the cavity is actually kind of squishy, like when we're feeling around with that little picky thing, an explorer we call it, and we can pick it through this enamel and feel the next layer. It feels sticky, and that's one of the ways that we know that you have a cavity there. It's like mushy. It feels kind of like leather. So with our drill, we remove that diseased area. Let's say we're not touching the nerves though. We remove this diseased area and we put a filling in there, so we replace that with plastic, with a composite filling, and we let you go. The numbness wears off, you get home, and maybe it starts to hurt. You start to feel some cold sensitivity, not keeping you up all night or anything like that, but it's cold sensitive, and now you're thinking, why did I get this filling done? Because now it hurts. Well, it's temporary that it hurts as long as your filling wasn't real deep. The reason for that is, even though we didn't go all the way into the yolk here, into the nerves, microscopically this nerve, egg yolk here, communicates with the part that we just filled. Like the nerves can still kind of feel that, and it becomes inflamed, and the teeth can't just feel something. Like I can touch my hand and I can tell that I'm touching it and it doesn't hurt. With teeth, if you touch it, it hurts like crazy. So they're really sensitive, and doing a filling in there sometimes will cause this yolk area or the nerves to try to swell up a little bit because they're inflamed, and they're in this case, this eggshell enamel case, so they try to swell, and it hurts because it doesn't have anywhere that it can swell, so it becomes sensitive to cold. And that can happen with a filling. With a normal filling that goes well, or any time that we drill or work on this area, can upset the inside, tries to swell, and hurts for a bit. That's inflammation. Ibuprofen or naproxen, any anti-inflammatory, can help with that. When cavities go further, that's a whole nother story. That's when we get in here, and if we're working with the egg yolk, we're working with root canals, we're working with removing the whole egg from your from your mouth. So that's another talk. But that's a really common frustration that people have, and they're asking that question. So there's the egg version of that, I guess. Hopefully that's helpful and makes some sense. When we're working deep into your tooth, we try to, warn you that you may have a problem temporarily with that filling, but I guess that's it for now. I'm going to have some eggs for breakfast. Everybody have a happy Easter. Thanks. Hi. So I guess I wasn't quite done. I actually ate half of this egg. So I had an idea just to tell you like what happens, the alternatives to getting a filling, because the next objection I might get from people when I have them in the clinic is, well, my cavity doesn't hurt now. If it's going to be sensitive after you fix it, maybe I should just leave it alone, see what happens, wait till it bothers me. Well, here's what happens if you do that. So I didn't even put any salt and pepper on it yet, so we still have a good analogy here. So if we're just growing a cavity into the egg white here, nothing hurts yet, and we don't do anything, here comes another analogy, sorry, but it's like rotting fruit. Okay, so if you had an apple on the counter, maybe you dropped it or something, it's got a bruise, and you don't cut the bruise out and eat it right away, pretty soon the bruise is gonna take over the whole apple, and pretty soon the whole thing's bad, right? So that's what happens with a cavity too. So that leathery kind of stuff I was talking about earlier, that's bacteria that is a cavity, it grows just like that bruise in the fruit. So you see where I'm going? It's going to grow, and it's going to grow into the yolk here or into the blood vessels, and then it will hurt eventually. So by then, your options are going to be either root canal treatment or removing your tooth. When we're doing it earlier, so we see the cavity and it doesn't hurt yet, where you can do a filling, and we're risking, maybe it's going to be a little sensitive, maybe it's not. Whereas if we leave it and let it grow, you're going to lose your tooth or you're going to need a root canal. So that's the progression of things. So that's why we recommend that you get the filling, even though there is a risk of sensitivity, because the risk of leaving the cavity there is much greater. So that's that. Now I'm going to eat the rest of my egg. Thanks.